my life. My name is Dr. Margaret, and I'm a plastic surgeon, and I live and work in Nigeria, specifically in Akwa Ibom State. So there's been a story going around social media, and as usual, it's always the same thing. Once somebody has done a plastic surgery procedure, they begin to try to ask questions: is it necessary? Is it not necessary? And all those kinds of things. And there is always the comparison that comes up: tummy tuck surgeries and cesarean section, or liposuction and cesarean section. And I keep wondering, why cesarean section all the time? Why not other kinds of procedures? There are so many other procedures in the world. Why must it always be cesarean section? So I'm thinking the tummy tuck and cesarean section debate is because both procedures are done through the abdominal wall. Commonly, it's going to be on women, and the argument about cesarean section, I think it's just an emotional one, bringing the fact that cesarean section is done to birth a child, and how useful is this procedure called the tummy tuck. All of that I'm going to talk about today in this my live show. So please do well to stay to the end, or at least watch a substantial part of this my live show. And if you have any thoughts, drop them in the comment section. I'll be very, very happy to address whatever opinion you have. It's going to be a very short live, just to address a couple of things, medically speaking, that is. Now, first of all, you cannot reasonably compare these two procedures without, first of all, knowing what these procedures are, and number two, the circumstances under which these procedures are being done, because there are different ways we classify surgeries. So you can't compare unless you know the circumstances. Some circumstances make a procedure less safe, some circumstances make a procedure more safe, and all of that. So we'll talk about that as we delve into the show. If you haven't already done that, please do well to subscribe to my channel and leave your thoughts in the comment section. I'll be very, very happy to hear from you. But what do you think? What do you think at this point in the video? Drop your thoughts in the comment section. Do you think a cesarean section is safer than a tummy tuck, or do you think a tummy tuck is safer than a cesarean section? Which one do you think is safer? Just a few seconds for you to drop your thoughts in the comment section, and then we go ahead. First of all, the way I'm going to approach this is, I think I'm going to have to tell you what a tummy tuck is, first of all, and then we also define what a cesarean section is. Number one, a tummy tuck is what we as medical professionals, plastic surgeons especially, we call it an abdominoplasty. That's the correct medical terminology for it. Abdominoplasty. Plasty means to mold. Abdomen, as you know, this is the abdomen. Okay, so the space between your chest wall and your pelvis, that's your waist, is your abdomen. So molding the abdominal wall is what we call abdominoplasty. So the whole purpose of an abdominoplasty is to remove the excess fat and excess skin on the abdominal wall in order to contour it and improve the shape and the appearance of the abdominal wall. So essentially, it is a body image surgery. Essentially, it is an aesthetic, or what we call cosmetic surgery procedure. That's what abdominoplasty is. On the other hand, cesarean section is not a cosmetic surgical procedure. An abdominoplasty is always an elective surgery. Elective means it is planned. There is nothing like an emergency abdominoplasty. It is a planned surgery. You'll see your doctor examines you, takes a good history, prepares you well for it, and goes through with the surgery. And it is done to improve your appearance. But let me be very, very clear. An abdominoplasty is a major surgery. It is not a minor surgery. It may be called cosmetic, it may be called aesthetic, or whatever you call it, but it is still surgery, and it is not just a minor surgery, it is a major surgery. That's an abdominoplasty. Cesarean section, on the other hand, is a procedure where an incision or an opening is made on the abdomen, on the wall of the abdomen of the mother, in order to deliver a baby. So the baby is going to be delivered through the abdominal wall as opposed to coming out through the, I don't know if I'm supposed to use the word, I'm not so conversant with YouTube terminologies. So I think through the vagina, I mean, it shouldn't be a big deal. So that is the natural pathway. But the other pathway is usually done if there are contraindications to delivering a baby per vagina. The doctor will make an incision in order to bring out the baby. Caesarean section is also a major surgery. Caesarean section is not a cosmetic surgery, it's an obstetric procedure. And caesarean section can either be done as a planned surgery, which means your doctor has seen you, there is an indication, there is a reason for this procedure, and the doctor says, let's go ahead and remove this baby. Thank you for coming, all of you. Please do well to subscribe to my channel. Also press the thumbs up button. So the doctor says, let's do a procedure to take this baby out, because either there is a problem with this pregnancy on the mother's health or on the viability of the baby. So the baby is brought out. Now, a cesarean section is not always a planned surgery. It can sometimes be an emergency surgery. And when I say emergency surgery, it could be because the mother starts to bleed. The mother starts to have an elevated blood pressure. The mother starts to have very serious abdominal pain, which may signify that the uterus, the womb, is about to split open and remove the baby into the abdominal cavity. Sometimes it does happen. So most times, when there is an indication for emergency cesarean section, there is no opportunity to plan and prepare the woman or the baby for that procedure. The idea there is speed and accuracy, and with every emergency surgery, there is increase in risk. So when somebody begins to say things like a cesarean section is safer than a tummy tuck, or a tummy tuck is safer than a cesarean section, the question now is this: under what circumstances? Because a cesarean section can be very safe, especially when there is no underlying problem and it's a planned surgery. The problem comes when it is not planned, and you cannot reasonably compare an emergency cesarean section with a planned tummy tuck. It's not a fair comparison. They're not even the same kind of procedures. They're not done by the same kinds of specialists. You're not passing through the same tissue planes. There are so many things, and there is no basis for comparison. These two procedures they are as different as light and day. They are not the same kind of surgery. So under what circumstances? That is the question that you should ask. So if somebody says that a tummy tuck is safer than a CS, maybe they have been encountering a CS being done as an emergency. So they have seen that a lot of women, some women have lost their lives, some women have had a lot of bleeding and all of that. That's because there is an underlying problem. And this surgery, there was no time to prepare the woman for the procedure. There was no time. There was just enough time to get the baby and the mother out of that theater alive. Now, that one, of course, the risk of mortality is high. So you cannot reasonably use that to conclude that a cesarean section is not a safe procedure and a tummy tuck is safer. Now, just because also, on the other hand, maybe some people have had complications from a tummy tuck, it does not also mean that a tummy tuck is more dangerous than a cesarean section. Because a tummy tuck, yes, like I said, is a major surgery. And with all major surgeries, there are risks attached. A lot of the times, the tummy tuck is going to be done under general anesthesia, which means you're going to be asleep. And when you are asleep, all your muscles are relaxed. And the muscles for breathing are also relaxed. So what happens is that the anesthesiologist, these are the people that put you to sleep for the surgery, will need to put a tube in, either through, obviously through your mouth into your throat, well, not your throat per se, into your airway. I'm trying to make this as normal as I'm trying to use the fewest possible medical terms to make it more understandable. They put it into your airway and they help you to breathe through that tube. And they use that to take over your breathing. Now, in that process of the anesthesiologist giving you medication to sleep and taking over your breathing, there can be problems. You can have problems. Problems can come up during that. There can be complications. There can be damage even to the airway. There can be some problems, maybe the tube did not go into the correct area. Your lungs may suffer for that. There are issues that can happen. Now, you may have underlying conditions that the doctor did not know about, and you could bleed, and other things can happen. And you can also have infection from in your wounds subsequently after the procedure. Sometimes you can have shortage of blood flow to your skin, and the skin areas may slough off. They may die off. These are complications that can happen. The funny thing is that all these complications can also happen in a cesarean section as well. And the complications of bleeding and other things that can happen in cesarean section can also happen in a tummy tuck. So both are major surgeries. Tummy tuck, like I said, is an aesthetic or cosmetic procedure. Always an elective, which means that you have enough time to prepare and be planned for the procedure. While the cesarean section can be elective or it can be an unplanned surgery. So when next somebody decides to ask you which one is safer between the two, please do well to ask this person under what circumstances, because a planned tummy tuck will always be safer than an emergency cesarean section. But like I said, these two procedures have nothing to do with each other, so there is no basis for comparison. So, like I said, it's going to be a very short live. So if you have any questions that you'd like to ask, I'll be very happy to answer. I'll be very, very happy to answer you. Just a few more minutes before I go. Alright, so thank you so much for watching my live show. You can catch me also on TikTok. I will be on TikTok live in a few minutes. And I think that's about it for today, and I will see you in my next video. Do well to click the thumbs up button, please, and also subscribe to my channel. And I cover medical content, and I also cover medical education as well. And I think that's about it. That's a wrap for now.